FM 89.3. It is your Real Talk Radio. Today, Saturday, is the 11th day of October 2025. And Saturday night like this, we come your way with Love 360. Love 360. And you know, the month of October, it's set aside for breast cancer awareness, not just creating the awareness, but screening to check for possible lumps in your breast. And we all know that early detection is key. So even if you don't do self-examinations, you do not check at all, at least this once a year, dear, you have got to check for any lump in your breast. And in case of anything, it will be identified early, and then there could be early treatment as well. So being in the pink month, we're going to talk about breast cancer, the breast cancer journey, mapping your way to recovery and renewal. That's what we're going to be talking about tonight. So tell a friend to also tell a friend to join us tonight as we come your way with Love 360 show. It's always a joy to have you joining me. So today it's an all ladies affair. Trust me, it's an all ladies affair, and it's going to be a one-on-one chat with our own oncology nurse specialist, CEO, Cancer Care for Humanity International, Mrs. Gifty Safo Anan. She's joining me tonight in the studio to talk about the breast cancer journey, mapping your way to recovery and renewal. We are live on Facebook, Fiila FM 89.3, so you can join us on Facebook. And as you join, please, you should also share so that others can benefit from our discussion. So share, and let others also benefit from what we're going to discuss tonight on Love 360. My name is Akusia Kwatama Boache. So from now till 10 o'clock, we will be here with you to talk about breast cancer. Good evening, Gifty.
Good evening, Mama.
Number the same.
Nyamina to mom, Pacha also.
Nyamio Yina Mobo. Or the Aduna do me pa. Okay, so today we are in your field of work talking about the breast cancer journey and then mapping our way to recovery and also renewal. So before we can look at any other thing, the journey and what have you, we want to understand what breast cancer is. So when we talk about breast cancer, what is it?
So when we say breast cancer, it is cancer of the breast. You know, our body is made up of cells, and the cells are like building blocks that God has put together to make our body. And so as we age and as we grow, there are times that some of the cells are damaged and they are able to repair themselves. And also at a point, if they are not able to repair themselves, then the cancer cells may keep on producing until they form a lump. And wherever these cells are overproduced, that is the name that we give it to it. And so if the cells are overproduced and form a lump in the breast, we say it's breast cancer.
Okay, so if it is any other part too, you add that part to it.
Yes, so if it's on the cervix, it's cervical cancer. If it's in the liver, it's liver cancer. If it's in the prostate, it's prostate cancer.
Wow. All right. So we are looking at the journey. Okay, the journey of breast cancer. I think so you briefly let's look at the causes, then we come into the journey proper. Yeah. What causes it, yeah?
So when we come to breast cancer, the cause is not known. We don't know what causes breast cancer, but we know that there are some risk factors. That is some things that we do and some things that we have no control over.
Okay.
And it leads us in getting breast cancer, such as we being women and having breasts. It's a risk factor. And as we are aging, as I said, the cells damages, and if the immune system is not strong enough to clear off any cancer cells that surfaces. Also, women who smoke or also takes alcohol, and people whose family members have ever gotten breast cancer, like your mother, your father, your sister, you are at risk of getting breast cancer. And women who has never given birth before are also at risk of getting breast cancer. Women who are also obese are also at risk of getting breast cancer. And also, what we should know is that there are other breast conditions, about 70% of breast conditions that are not cancerous.
Okay.
And so the cancerous ones are about 30%. And genetics put us at risk about 10%. And so we should also put in mind that when you hear that somebody is having breast cancer, it is not a must that the children will also get breast cancer. There are other risk factors that comes into play as well.
Okay. All right. So let's look at the signs and then symptoms of it.
So for an individual to know that what I'm saying probably may be breast cancer is breast cancer lumps initially are not painful. So you may see a lump in your breast, sometimes on your chest, sometimes in your armpit, that you may be taking antibiotics and it's not resolving. These may be a sign of a breast cancer that you need to come. So initially it may not be painful, and so you may be staying in the house for a year or two until it starts paining before you come to hospital. No. The moment you see a lump, whether painful or painless, please come to the hospital. Let us check for you. There are times that you see that with you, your nipple is everted or standing, but at a point you see that it's pulling inside. Then there are times that you see that your breast has become reddish, or the skin of your breast is part like that of an orange peel. You need to come for us to check what exactly is happening. There are times that you see that part of your breast has gone inside. That's the dimpling. You need to come for us to check what exactly is happening. There are times too, one of our breasts is a little bit bigger than the other. But there are times either the cancer may be pulling one up too much or pulling it down too much. When you notice these changes in your breast, you need to come for us to check. Also, there are times that you see that there's a bloody nipple discharge or brownish discharge coming out from your breast, from your nipple. You need to come for us to check what exactly that is happening. Because there are times you may not see a lump in the breast, but you may see a nipple discharge, which is bloody or brownish.
Okay.
You may also see a swollen lymph node on your chest or in your armpit, but there may not be any lump in your breast. When you see all these signs, you need to come for us to check.
Thanks so much. So we want you to take us through the journey, okay? The breast cancer journey, through the multi-stage processes, beginning with the diagnosis and moving us through the active treatment stages as well.
Thank you very much. So when it comes to breast cancer diagnosis, we have what we call triple assessment. So first of all, you come, then experts will do what we call clinical breast examination, which we are advocating this month that every woman, every man, because breast cancer doesn't affect only women. About 1 to 2% of men also get breast cancer. And so we are advocating that come for experts to check your breast for you. So first is the clinical breast examination.
Okay.
Then also we have what we call either an ultrasound or a mammogram. We use an ultrasound or mammogram to also check the breast as a form of screening. So ultrasound is for women who are below age 40,
Okay.
and mammogram is for women who are above age 40, because mammogram is able to detect breast cancer even at a point that it has not formed a lump yet. Is able to detect it. And also we have biopsy, whereby the lump that is in the breast part will be taken to the lab for a pathologist to analyze and tell us whether it's breast cancer or not. So these are the stages how we diagnose breast cancer. Then after the diagnosis, you need to do what we call some lab investigations, and also what we call a metastatic workup. So the lab investigations will help us to know your blood level, help us to know how your kidneys are functioning, is everything all right, help us to know whether the liver is okay, because the cancer medications are so strong, and so we need to be sure the liver is in good condition, the kidneys are in good condition. And also we also do what we call metastatic workup. When we say metastatic workup, it means that the cancer, it doesn't stay in the breast alone, it travels.
Okay.
Once it gets blood vessel or a lymphatic vessel, it's able to travel through it, and it can go to the lungs, the liver, the bone, or the brain. And so we do this workup to be able to check whether the cancer is only in the breast or it has traveled to the other parts of the body. So after the metastatic workup and the laboratory investigations, then we now know, is the intent for the treatment curative or for palliative. When we say curative, that means the cancer is still in the breast, and so we are aiming at cure. But if the cancer has moved to the lungs, the liver, the bone, or the brain, that is where we say is palliation. That means we are managing the patient till the time that God will take the person. And then we also manage
But at that stage, there isn't much you can do.
Yes, but we can do something. We can do little. We can do something, but not with the aim of curing the person. So we manage them with the palliative team, even though they are few, but we refer some cases to them, then we manage it together with them. Then if we get to know that it's for curative intent, then we are going to put the patient on what we call, depending on the stage, if it's stage 1 or stage 2, probably surgery is done. And that is if it has not gone to the lymph node in the armpit and it's only in the breast and it's about 2 centimeters. The lump is about 2 centimeters. Surgery is done. And based on the pathologist analysis, the patient may need chemotherapy, that is the cancer medication, or not.
And it's doom training.
Yes. Then also, if we get to know that the patient is going to take chemotherapy, we give the chemotherapy for about 8 cycles, depending on everybody in the system. Sometimes when you start the treatment, some of them they may not be responding to the first line of treatment, and so you need to change it. And that is what may make some of them go beyond the 8 cycles that they are supposed to take. When we say 8 cycles, it's cancer medication is given every 3 weeks.
Okay.
Every 3 weeks, because it's a strong medication, and it's such that it's not able to differentiate between normal cells and the cancerous cells.
Okay.
So when it gets into the system, it kills the cancerous cells
and
some of the normal cells around it. And that is what brings about the side effect.
Okay.
And so the normal cells, when they are affected, the 3 weeks gives them room to be able to repair themselves. So every 3 weeks you come and take the medication for 8 times. And if the response is good, then you can go in for surgery. After the surgery, then you go in for radiotherapy in Kumasi or Accra. It's also a form of treatment, just like you going for an X-ray.
So if after the 8 cycles, you still go in for surgery, why don't you just do the surgery straight forward?
So it's because of the late presentation. People are still presenting at the late stage of the disease. And so that is why I said, if you come and the lump is less than 2 cm or 2 centimeters, then surgery can be done. That is if it has not gone to the armpit. But then people come whereby the lumps are more than 2 centimeters, and also it has gone to the armpit with swelling lymph nodes, and also the skin of the breast has changed. So at that stage, surgery cannot be done. You have to take the cancer medication, which is the chemotherapy, before, when it shrinks it, then surgeons can come in.
Okay, so the chemotherapy shrinks.
It helps to shrink the cancer, so that surgery can be done. Because if surgery is done straight away, it can spread very fast.
Okay.
It can spread very fast. So ideally, the first treatment for cancer is supposed to be surgery. But because people don't come early, that is whereby we have to give the chemotherapy so that it can shrink the tumor or the cancer, so that surgery can be done. Then after surgery is done, the pathologist will still report on the sample he has received and let us know whether the patient will need radiotherapy. And the radiotherapy is just like you going for an X-ray. It's a form of an X-ray, but higher than that, which helps to kill any leftover cancerous cells that the surgeon was not able to take out. And we don't have it here, we have it in Kumasi or Accra. Then you go for that treatment. After that, then we look at where the cancer cell is getting its nourishment from. Cancer cells, we all take in proteins to grow. Cancer cells also have food that they use to grow. And as we all know, when we are aging at age 13, now 11 and 10, you see, you are getting your menses, developing breasts, and all that is the work of what we call hormones in our system. Some of the cancer cells get their nourishment from these hormones, which we call the progesterone and estrogen. Then also we have proteins in the system. That's what they are supposed to do, is to help damaged cells to repair themselves. There are also proteins called HER2 proteins. There are times that when they are also overproduced, cancer cells are able to feed on them to grow. And so if the cancer cells are getting their food or nourishment from these hormones, then you will put you on hormonal treatment after the radiotherapy, so that it will suppress the production of these hormones. And also, if these cancer cells are getting their nourishment from these HER2 protein, then we give an injection, which is a synthetic protein, to the patient, so that the cancer cells, because it's a synthetic one, when they take it, they will not, instead of it helping them to grow, they would rather die.
Okay.
Then also we have the aggressive type of cancer whereby we don't know where it's getting its nourishment from, which we call a triple negative breast cancer. So for them, they will always be coming for follow-up, and what you need to do is to boost your immune system all the time. And what I want the general public to know is that every breast cancer is different.
Okay.
We have different types of breast cancers and how they behave. So if some, as I've mentioned, this journey is very smooth. Somebody may get it this way, but some may not get it this way, because at a point they may not be responding to the medication, and you will have to change it to a second line medication. Some may also go in for surgery and may get some form of complications. And some too may not get money for radiotherapy. Some may go in for radiotherapy and get some extreme side effects and all that. So every breast cancer journey, it's unique. If you talk to any survivor, their journey are unique. So we need not to compare ourselves to others when we are towing the journey of breast cancer. What you need to do is to make sure that whatever your clinician instructs you to do, you are doing it as such. Then also we pray that whatever treatment we are giving you, it will go smoothly as it's supposed to go. So this is the curative journey. Then when it comes to the palliative journey, that is whereby we liaise with the palliative nurses. Ideally, palliative is not just for cancer patients. Palliative is for anybody battling chronic diseases, because what they do is to manage your pain and also make sure that you put your things right before you pass on. Because when you are battling with a chronic disease, anytime, any moment you can go. That is why people say that, oh, she wasn't sick, she only complained that her chest having difficulty and just passed on, especially those with hypertension, that is maybe having myocardial infarction or something. So palliative people help us with the patient realizing what their condition they have now. Then also they help them manage their pain, help them put their things right, help them to be able to forgive people that they've offended if they have not put down their will or do things right. They'll be able to start putting their things right because they know that one day they will not be there. So we help patients with palliative just to make sure that they don't die a painful death, but they die peacefully. And so with the palliative, we give some form of chemotherapy, but reduce those, because that is the only way that will help control the cancer. So we don't give the actual dose that the body is supposed to take. We need to reduce it because the patient is going to take it for a longer period of time. With that one, even though they also come every 3 weeks just to come and take the chemotherapy or the cancer medication, but because they are going to take it, let's say, so their strength can no longer take it, we reduce the dose. And also anytime they are in pain, we manage their pain. As and when they have any symptom that needs to be managed, then we manage it as such.
So they more like a psych, also psych them up.
Yes.
And
yes. And the palliative nurses are very skillful.
Okay.
With that,
they've been trained
for
that.
Yes.
Okay. All right. Sounds interesting. I ask some more. All right. So looking at the journey you've taken us through, okay, how does it affect both their physical and then their mental health?
So one thing I always tell my patients when they come is that for you to get well, it starts with you. We are going to do our best, but then if you tell yourself that you are not going to well, you will not be well. So get a positive mindset that you are going to be well. If people have survived breast cancer, people have died out of breast cancer, pray that God will help you to be among those who have survived breast cancer. And so these are some of the words I use to encourage my patients, even though the most challenging and what makes them so emotional and it's the financial constraints, because cancer management, it's very expensive, and mostly people who come are not people who are well to do. They are just mothers who are struggling to make ends meet. I remember one of our patients, the daughter was to go to a tertiary institution and this thing happened.
Wow.
And apparently she and the mother has gathered money for her to go to school. So when the cancer started, she has to be using her school fees too, so she couldn't go to the school. But eventually, because she was the only one, there was no support from the family, even though according to them the family was well to do. We called for family conference and trying to let them know the stage at which their sister is for them to support. But then after they left, there was no support from the uncles. They only went and telling people that she's now having cancer, but there was no support. So this girl kept on struggling to support the mother, but because there was no money and the radiotherapy is expensive, she couldn't raise money for the radiotherapy. So the cancer progressed after the surgery. The mother
after you diagnosing it early.
Yes. She was able to take the chemotherapy and go through the surgery, but because she couldn't go for the radiotherapy, the cancer progressed. Then she came back. And that time,
so the radiotherapy, to how often is it supposed to be done?
So the radiotherapy is supposed to be done after the surgery, based on the pathologist's comments.
That's once?
It's once.
Oh, okay.
And it's depending on the workup they will do for you. Some take it about 7 days, some 10 days, some 2 weeks. Continuously, every day. It's the way, it's race. So they have a way of dividing it or calculating it based on your body mass index, and they'll be giving you in little doses.
Okay.
Yeah, because it also has its own side effects. So if they give it at once, it will knock you down. So they break it down and give it. So because she couldn't go for the radiotherapy, the woman passed on. May her soul rest in peace. So these are some of the challenges. I can
imagine what the daughter will go through, because after missing your education, you still lost your mom.
Yes. So it's a big blow for her.
Okay, so it's a sad and a difficult moment though, but we need to discuss it, and that's why we are here talking about it. So that if for nothing at all this month, don't miss going for the screening, because between me and you, even if we do the self-screening, so once in a year, we don't miss the professional touch. Let the professionals do their work, so that if it is detected early, it will be curative, and you will not get to the point of the palliative care. It's very, very important. So let's look at the post-traumatic stress. The post-traumatic stress, and also the post-traumatic growth as well.
So thank God it's not here that we don't have it yet, but there are some survivors who goes around once a while to support people. But when you go to down south, the survivors has been able to put together a support group.
Okay.
And they are really, really many. And we have some Dagomba women who are also among them.
South.
Down south.
But they will not come and form some here to support each other.
So that is what I said. With here, there's stigma. So people are there. They are doing things in their own small way, supporting cancer patients secretly. But they've not been able to come out as down south they are doing. Because when people come out of breast cancer treatment, there is still this fear of recurrence. And so you will need people like the support group who are also breast cancer survivors, and they have platforms whereby they do monthly education for them, what to eat, what not to eat, reminding themselves of how they can boost their immune system. And so with this support group, it has make it very easy for us. At first, when there were no support group, that was where people thought, oh, I'm alone, and this depression and all that sets in. And there are psychologists that sometimes we refer some of them to them, and those who can join the support, when they join and they see, oh, this person, this age, had these years surviving breast cancer. There is this woman called Maud Loco. She is a triple negative breast cancer survivor, and she has survived.
Triple negative means what?
That is the one that I said is the aggressive type of breast cancer, because we don't know where the cancer is getting its nourishment from.
Okay.
And so for her, she has survived breast cancer for 12 years now.
Wow.
So if
with
you
that
hear
condition,
with that aggressive type of breast cancer, so if somebody who has been diagnosed of the aggressive type sees that, oh, if Maud Loco has survived for 12 years, then I can. So that courage and that confidence come. And so they being on the same platform, it really, really helps. So these are some of the things that helps our patients psychologically after their treatment. Either than that, it would have been very, very challenging. Even with that, still, because some of them, the way their partners treat them, the kind of utterances they say, is as if once they are diagnosed with breast cancer, that means they are not a woman again, so they need to get another woman. And how they even go about it, how they even say it, it becomes a big blow to them. But when they get this support group, sometimes they sharing their experience and all that, it really, really helps. And also seeing breast cancer survivors on TV, and I believe if people are watching, when you check on TV3 and other TV stations, you see the Breast Society of Ghana with survivors all over sharing their story and their journey with breast cancer. It makes it so easy for people diagnosed with breast cancer to also psych their mind that they are not alone. So that is one thing that is helping, but still secretly in their closet, there is still some form of psychological distress here and there. But the moment they get another person to talk to, then they are okay.
All right. So if you just tune in, this is Fiila FM 89.3. And this evening we're talking about the breast cancer journey, mapping your way to recovery and renewal as well. It's 13 minutes past 9 o'clock. So we didn't start early. So I'll open the phone lines and then you can also join me. You can join us and then share your thoughts, your contributions, or if you have any questions, you can ask those questions, and then our expert is here. She will answer you. So, Gifty, let's talk about stigmatization. Why do we stigmatize people with or survivors of breast cancer, if I could put it that way?
Thank you so much. So, as I mentioned earlier on, because one of the risk factors is family history or genetics. So, people think that once a woman is diagnosed with breast cancer, that means their children are definitely going to get breast cancer. So, people who have been diagnosed with breast cancer, some are hiding, even though they have survived it for 5 years, 6 years, 8, 10 years, they don't want to come. I was surprised to see an elderly woman, 86 years, who came to our facility, I think 3 weeks ago, and she had only one breast. So upon taking the history, the children made us to know that she had breast cancer 28 years ago.
Whoa.
And she's still living and living on. She came
And
with
in her 80s.
yes,
Wow.
86 years now.
Wow.
And according to them, she's having a problem with the other breast. And God being so, when we checked, it wasn't that the cancer has come back. It was just inflammation of the breast, of which she was given medication, and she was okay. So because of the stigma, this elderly woman could have come out there and tell them that, look, after breast cancer, I gave birth to 2 children, and I'm still living after 28 years. But she's also careful because of the children.
Stigma,
Yeah, people will say, hey, this family, their mother had breast cancer, so you cannot marry from that family. And also, sad to say that the patient husband told her that now that you've been diagnosed with breast cancer, I have to marry another person because you can't give birth again.
If you are diagnosed with breast cancer, you can't give birth again.
It's not true. It depends on everybody in the system. You know, when you are taking the cancer medication, you are not able to menstruate again, and so that means that giving birth is going to be difficult. But we have patients that a patient who took cancer medication and went 2 months, was not coming due to financial challenges, came back. We saw that the tummy was becoming big, and we thought that I thought that it was I thought that the cancer has either gone to the liver or something. Only for her to come the following month, a colleague of mine made her to do an ultrasound, and it was twin pregnancy. And that she gave birth.
Wow.
Yes.
Wow.
So the fact that a woman, though it delays, it's just like somebody being on family planning. Then when you stop, somebody immediately they stop, they will just pick seed. Some it will take, I learned some it even take 5 years or even more before they pick. It's just like that. So it takes time for the body to come back to its normal state to be able to get pregnant again. And also depending on your type of breast cancer. Depending on your type of breast cancer, that will make it very difficult for you to give birth again. You know, when you get pregnant, it's the hormones that are in place, and also make sure the baby it's okay and all that. And so if your cancer cell is getting its nourishment from the hormones, it's going to be difficult for you to get pregnant, because when you get pregnant, that means the hormones level is going to increase, and the cancer can come back. But we have people who were having the hormone positive and have still been able to give birth. And it's not this patient, that there was another patient who also was able to pick seed again, I think some few months after treatment. Then she too was a twin pregnancy.
Hey.
Yes, so it depends. So because of that, this stigma and how people, there are people that their husbands will say that now that you're having breast cancer, go to your family house. And they sack them.
Wow.
To go to their family house. Some too, they don't no longer sleep with them in the same room. They give them a different room to sleep. And we notice that patients who come to the facility with their husbands or have their husband full support psychologically, financially, their survival rate and their recovery is very, very high.
Okay.
Yes. So these are some of the challenges that our patients go through, and so they will even be hiding it from their own siblings. Probably, if not because of the stigma, they would have whispered to them so that if anything, they will be able to take care of themselves. Because we have patients who have come and their mothers had breast cancer, but then they are having it and they don't want their siblings to know, all because of the stigma.
All right, so it's 19 minutes past 9 o'clock, and we're still looking at the breast cancer journey. We just talked about stigmatization, which doesn't really help at all. It doesn't help them, the survivors, or their healing to go at the rate that is supposed to go. So please, let's stop this stigmatization and all that. So as you are doing the listening, you can join the conversation on 0249 535 600, 0249 535 600. If you want to send yours as a text message or WhatsApp message, you can send it to the same number, 0249 535 600, 0249 535 600. So then, Gifty, looking at this woman you cited as an example for us, the 86-year-old woman who has survived or has been living with this condition for like 28 years, survived for 28 years. So it means that she got it around maybe in her 60s or late 50s.
Late 50s. Yeah.
So which means that even at that age you could still be at risk.
Yes. Now breast cancer, at first the most people were around 50 plus getting breast cancer.
Okay.
But now we are seeing below 30 years and 30 years. 27, 28, 29, 30 coming to our facility with breast cancer.
Wow.
Yes. Wow. And I think all the ones I've come across, none of them have a family history.
No family history.
No family history.
Okay, let me pick this caller and then we'll come back. Hello.
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 Good evening.
Good evening, Osoja.
Yes, ma. Everything I'll mention my name again. This old soldier calling from Yapi, the soon-to-be Garden City of the North.
Okay.
Ma,
yes,
wow, this evening. Wow, breast cancer. Ma, we salute our ma with you there. Allah bless her for us.
Amen.
She has lectured us, told us what breast cancer is. Some of us were just seeing it to be, excuse me to say, something very, very, very dangerous and treacherous, that even if you get someone like that you are meeting and you know that person, so you just return or detour so that you will not even meet the person. But with this, you've seen that no, it is not like that. Well, like this 86 man,
yeah,
you see, with her encouragement and this for the love of the children and for this stigmatization, or what is this called, that has been a very hectic thing. I mean, that people even just with that alone, it will kill you when you are not supposed to die self.
Yeah.
What can we do to break this stigmatization?
Okay.
That's one. Two, we the men too, if not today, like I'm saying, we've gained a lot of education. I think Ma said, is it 1 to 2% of the men too we are likely to, or we have this breast cancer.
Yeah. Yeah, it can have, yeah.
Meanwhile, the men's breast is different from that of the women.
Breast is breast now.
Okay, it's different. When we were young, we the men and women, we suck our mother's breast, suck the milk, and the same doctors advise that we should really take it maybe probably up to 2 years before you can stop taking the breast medicine.
Okay.
But here's the case, some of we the men, I don't know, we are so appetizing and we are so attracted such that when we get our wives, then we at times grip this breast and suck like we were young and be sucking. Meanwhile, during Madame this, there are signs and symptoms which will indicate that maybe some of the breast will be showing some symptoms of maybe fluid. Then you, this man who likes milk, sucking your wife this and mama, then you go and suck this thing. Can you be affected? And if you be affected, what will it also be breast cancer or a different thing altogether? And what do we do to stop this?
So also, if I can understand you, do you mean if the woman has breast cancer and you suck, that you can be affected? Okay.
Yes, exactly.
You okay? All right.
Because some of we the men will not stop sucking. We will not stop sucking. And the women too, they shouldn't feel shy. Because even if it is anything, it is by way of something that you have acquired that you didn't take money to go and buy it.
Okay.
So why should you, the man, you have a woman, like, let me use myself for example, man.
Yeah.
I had my sight and saw my wife, very, very, very beautiful. She was the most beautiful woman in the world that I saw. Beauty lies in the eyes of the beholder. And now I've married her.
Okay.
So if she should go blind, or I should go blind, like I'm really blind today, it's true. I'm blind. I'm a blind person. Should my wife leave me? Should my wife leave me because I'm blind?
No.
No. Should I leave my wife because she's blind? So why should my wife have breast cancer? And I will not encourage her and even persuade her. I mean, patient comfort. I mean, you have to give the patient some sort of comfort. You know, I'll leave it there. People are coming to ask more questions or to give us more points to enjoy, in addition to what our ma has made some of us very happy this evening, and that we will be cautious of certain things. And then, finally, the food to take, not to maybe encourage cancer in our bodies, and what to take to discourage cancer in our bodies. That is my point.
All right. Thank you very much, Osoja. Thank you very much, Osoja. Okay. So, Gifty. Osoja, the questions no be brave. So, what can we do to stop stigmatization? That is one.
So what we can do to stop stigmatization, I want us to know that breast cancer is not contagious. If a sister, a mother, a brother, a child is having breast cancer, it cannot give it to you. It's not contagious.
Okay.
Then secondly, we should know that breast cancer is just like, if you get malaria and you don't treat it for 2 weeks, you can die. So, but because we know that malaria is caused by mosquitoes, we buy mosquito coils, sleep under treated mosquito net so that we don't get malaria. Breast cancer is just like any other condition that has come to stay. Okay. And also we should embrace it as such and see how, as he asked, that what can we do to prevent it or protect ourselves. Breast cancer is just like any other condition. We shouldn't think that when somebody is having cancer or breast cancer is because the person has been bewitched, or a rival or an auntie or a sister or a colleague is the person doing that person. No, we should see that it's just a condition.
It's not spiritual.
It's not spiritual. I will not say if you want to spiritualize it, that is you. But then do your prayers. But then come to the hospital and get the cancer medication while you pray.
Exactly.
God has given us wisdom. And so if you see fire and you say that, oh, I am spiritual and I have faith, you put your hand in the fire, you will die. It will burn you. It's the same way. God has given us wisdom. In as much as you are praying, please come to the hospital, take the cancer medication. Then you will be okay. So, and to also stop stigmatization is for our spiritual leaders, our pastors, then our magajiers, our
imams,
mosques, community volunteers, team up with the health personnel, then also give education, let the people and the community know that breast cancer is not contagious. When you get breast cancer, it's not that somebody has bewitched you. Go to the hospital, get yourself checked, get yourself treated. These are some of the things that we can also use to demystify stigma, also encouraging the men and the women to support their wives and their husbands when they are battling with cancer. Thank you.
Okay.
And when it comes to his other question about sucking the breast, so when you suck your wife's breast, most at times is the men that are able to see the lumps for their wives. There are a lot of women that said, oh, it's my husband who saw that there's a lump here and said I should come and check. So at that time, you don't even know whether it's breast cancer or not.
Okay.
And even when it advances and it's having this soil, you cannot even suck. But at the point that where there's some little lump in it, you don't even know. And it's not contagious. So you sucking it will not let you get it. Thank you.
Okay, so I hope you've gotten it.
So we'll talk about the prevention when we are ending.
All right. So let me see. Kawawa has sent a message. It says, "Good evening, AKB, and to your resource person. I'm currently hearing only one voice. AKB, you know my story. I don't have the statistics, but AKB, I can tell you the survival rate for cancer patients is negligible. It's very expensive to manage cancer. I don't even wish this condition for my enemy, if any. Chemotherapy is very painful and expensive. As at the time we were managing our patients, our water bodies were clean. My fear is galamsey and cancer."
Yeah.
Now, my question is, how long will it take one to recover, all things being equal? Why can't the government support with a scheme? Why do the patients become dark and lose their hair? How come till date the drugs are too expensive? Breast cancer is not contagious. Why the stigmatization? How do we demystify breastfeeding cancer? By catching them young, and the education in schools is now dead. So 7 questions. So Kawawa, why interview na mami? So you say the first one, how long will it take one to recover, all things being equal?
So as I said initially, it depends on the intent of the treatment. So if it's for curative, then it may take, depending, as I said, if the patient system is able to receive the first line of treatment without any problem along the line, then with that way, within 8 months, the person will finish with the chemotherapy and maybe go through the surgery and recover maybe within about 2 or 3 months, go through radiotherapy for about 2 weeks. So let's say with the breast cancer, if it's curative, the patient may spend like a year for the chemotherapy, radiotherapy and all that. That is, if the person has money and is going through everything smoothly, maybe a year and a half. But then if we are putting the person on the hormonal treatment or the synthetic protein thing, The patient may take it for about 5 years.
Okay.
And after breast cancer, you don't stay home. You need to be coming for what we call follow-up because you are in remission. Remission means that the cancer has a potential of coming back.
Okay.
And so we need to monitor you. So you come every 3 months, then later every 6 months, then later every year for us to be assessing you to be sure everything is fine. And if it's palliative, as I said, it has gone to other parts of the body already. And so the patient is going to be managed together with the oncologist and the palliative team until patient's strength can no longer take treatment any longer. So it depends on the intent of the treatment, how the patient presented. The second question.
Okay, so the second question, I don't know if you are the right person to answer though, because it's asking why can't the government support with a scheme?
So with the National Health Insurance, there are some of the drugs of breast cancer treatment that is on insurance. But then if you come to the facility,
Some drugs.
yes, some of them, about 4 of them or so, are on health insurance. So if you come, depending on your type of cancer, if what is on insurance cannot help you, that means what the other treatment we are going to give, you will have to buy.
pay for, yeah.
And aside that, even if you come to the facility and the facility is not having those medications that are even on insurance, that means you have to buy. So some of the medication are on health insurance, but not all.
Not all. Okay. All right. So that why do the patients become dark and lose their hair?
So if you remember, I mentioned that and researches are still ongoing. And as he said that why is cancer medication very expensive? It's very, very expensive to conduct research. And aside that, sometimes when patients come to the hospital, you say, oh, you are conducting a research, and a lot of people don't want to buy into it. But then it's these researches that will help the pharmaceutical companies to be able to know what type of specific treatment that is good for us. If you look at our form of treatment, what we are using are trials that has been done in the diaspora. So it's now that they are trying to do. So when you can say, oh, we want to take your saliva, you want to take your stool, you want to take your urine or something, people don't want to buy into it. But then these are the researches that will be done that will help them to be able to know that this medication will be good for blacks and this medication will be good for whites. And all these things, it boils down with money, very expensive. So sometimes it is not them. If they don't get funding to be able to do researches to know what specifically can attack only cancer cells. So for now, the medications we have are not able to differentiate between the normal cells and the cancerous cells.
Yeah.
So that is what brings about the side effects.
All right. So you've already tackled how come till date the drugs are too expensive. You boxed it together with it. And then that breast cancer is not contagious. Why the stigmatization? Even though you've answered that one already. Okay. And then how do we demystify breastfeeding cancer by catching them young?
Breastfeeding.
Yeah,
and
me,
cancer.
I'm not getting it that well.
So what I don't know, but I know that some men think that when you suck your wife's breast to prevent her from getting breast cancer. No, it's
Okay,
only
so,
when a baby sucks the breast.
Yeah, so I think we sent it. Why can't we demystify breast cancer in our schools by catching them young?
So we go to schools and we educate them about breast cancer and the risk factors.
You do that?
Yes, we do that.
According to him, he's a master in Ghana school. That
So-
education in schools is now dead.
So what happened is that the schools are supposed to invite us.
Okay.
You write to the CEO of Tamale Teaching Hospital
Okay.
that you need the breast cancer awareness team to come to your school and give education.
Okay.
So our doors are open at the Tamalite. Once you want us to come to your organization, your school, wherever, just write to the CEO and he will channel the letter to the appropriate unit that is supposed to handle it. Yeah.
All right. So the schools, you will have to take the initiative and invite them. He says AKB is not a site to see cancer patients at Kolebu
Yeah, because they are seen in thousands. Kolebu and Kofanochi are seen in thousands. Sweden, Ghana Medical Center, the one that is owned by teachers, are seeing patients in thousands, and we are seeing patients in hundreds. So sometimes when our patients go down south, they become so confused because they never knew that the cancer, like a lot of people are having the cancer, they thought they were alone. Yeah.
Okay. That's interesting. So our phone lines are still open: 0249535600, 0249535600. Before we come to the prevention aspect, let's look at family support. Okay, very, very important.
Yeah.
So how can the family support patients or survivors in their maybe renegotiating roles and then responsibilities?
So first of all, family support it's very, very crucial when it comes to cancer management, because as the side effects are individual difference. Some of them may get a toll on them. They are not able to work any longer, and they are not able to do certain things in the house, and so they need financial support.
Okay.
They need emotional support. They need support with whatever that they are doing. Is it they are trading? They need support in the house. They need support from their children, their husband, or their wives. So the family really, really plays a role all the time, making sure the patient is happy and all that. These are some of the things the family can do for them, and also support them financially. What they will eat is also very, very important.
And is this same family that the survivors are also running away from?
Yes, because some people, even though they are siblings, but they are not one. Because of this polygamous
sibling rivalry,
yes,
too,
and all that.
Okay.
So because of that, one may not want the other person to know. But then your children, your husband, they should give that maximum support and all that.
Okay, let me pick this call. Hello, good evening.
Good evening, Madam KV.
Yeah, Kawawa.
Yes, Madam KV.
Okay. What why?
Me
say what why?
No. AKB, you cannot be discussing cancer and I'll not make a contribution.
Okay.
Normally I don't usually call into last 360 do I listen to it out. AKB, I always have nostalgic feeling when breast cancer and cancer is mentioned because of my experiences that But AKB, as your resource person said, that's my fear. Those days, as at the time we were managing our patient, I think she also defied what she's saying.
Okay.
The whole family and our side up to date, both parents' side, nobody had it, and up to date by the grace of God, nobody has had it.
Okay.
But at the hospital, at the college, we realized that most of them had a family history. Those who were meeting there. And now, as she said, if you go through it, most of those contracting it don't have that family history.
Okay.
And that's where my fears come, the environmental factors, and especially the way we are just playing chaskili with this issue of galamsey. We just finished our Rosary Congress at the Aliu Mama Stadium.
Yeah.
Then the Catholic Bishop Conference hammered just on these two issues, galamsey
and peace in Boko and Bingili and peace in Ghana. And you can see there's now a national canker. My question is, it looks as if the military force alone cannot solve this galamsey issue. As health workers, how can they also join in this fight, maybe by showing communities and places that are affected with these galamsey issues, and AKB, they are seeing the effects on this issue of galamsey through health-related issues and the rise of cancer in that area. So I am pleading with my sister, if the health workers can also join the galamsey fight by showing pictures of the effect of galamsey and how it is related to the increase and the rise in cancer patients in their facilities. I learned that for kidney issues there is quite obvious now that the galamsey is causing it. I think when they come in also with the cancer aspect, by showing the pictures in the galamsey areas, it can be to help one way to solve it, and we all not go through this painful chemotherapy and radiotherapy. It can be just wait and see the face of a patient who have come out of the chemotherapy room. And it can be sometimes when they are using the machines and you are sitting in the waiting room and there are the holes in the key lock. I don't know whether it's fire that comes out of machine. Only God knows. So it can, even if you have the money, it's very painful to manage it. As at the time we were managing, we were going to Tamale to Kolebu every 2 weeks. And it can be at every session, you can spend not less than 1,200.
How many years ago?
And that was almost 10 years ago. Or is it 15 years ago?
Wow.
And the drugs, AKB cannot talk. And because of that, I'm passionate about it. I still follow some patients or I still read a lot on it. And AKB now it is worse. And that's why in my write-out, I say the drugs are very expensive. So the education in our schools to help. Let us catch them young. And I just heard them say the school should write.
Yeah.
I'm pleading that if they are going to wait on the school to write, they will be inundated with thousands of patients who could have been helped if they had known. So I'm pleading that TTH should also make it a project by knocking on the doors of the headmasters and coming to check on them. The candidiasis was one thing I knew TTH used to come and test our students at school. That one too is dead. And it's a canker currently in the schools and the students don't know how to manage it. Even that, let them put common candidiasis. If the issue of cancer also comes in, it will be serious. So I'm pleading that TTH should also take it upon itself. If Prophet Muhammad is not coming to the mountain should go to Prophet. Thank you very much, AKB.
Okay, thanks very much, Kawawa. Was it mountain no munko Mohammed Hawaii? So Mohammed and my mountain no should go to Mohammed.
Which school is that?
He's in Ghana school. He
Okay,
teaches Ghana school. We should be more pa.
I'll discuss it with my director.
Aye. So from all that he said, do you have anything to say about it, or we should move on?
With the galamsey issue, it goes beyond me. But then I remember during the Buhaha when a resource person, I don't know whether she's in US or UK, and was talking about how nowadays even our water, when after they have treated it, they still tested hard metals inside, and so they cannot assure us that the water that we are taking in is safe. And that is the most painful thing. The chemicals they are using, it doesn't leave the soil, and it goes into our water body. It travels far. We are using it to water the fruit, the vegetables, and all that. And as he said, the canker with which it will bring us when it comes to cancer in the next few years is going to be serious. And so we are pleading with our politicians, our governments to do something about galamsey. And I think earlier this year, some health professionals stood up and started talking about it. And you know, these things, it goes beyond we
Of course.
the people down there. It's just the top people who can make noise about it. And as he said, everything also boils down to research. So as he said, if researches can be done, especially at the areas where galamsey are being done, and we were able to pick up how many people have gotten renal disease, how many people have gotten cancers, then we can use it to make a case.
Okay.
But then if we are talking, it's causing cancer, it's causing blah blah blah, but we
You
don't
know,
have the evidence.
While
through
we were
research.
talking, what came to mind was like showing the picture, showing this, that. Those doing the galamsey they don't even see it.
Yeah, yeah.
What they don't even
Yeah.
watch
And-
television, so
yeah,
they
and-
won't even see what is going on.
Yeah,
Whatever pictures you are showing
yeah.
about what galamsey is doing to
Yeah.
the people. Ohun kura of our home.
And that is how greediness has taken us. to-
Seriously,
Yeah.
very very serious. This galamsey issue, they are not doing. Are not adding.
And also our lifestyle. So aside the galamsey, what are you personally doing to protect yourself against cancer?
Okay, so
also
that
very
that
important.
brings us to
The prevention, aspect. Okay,
exactly.
so we need to, if you are somebody who takes who smokes, you need to stop smoking. The painful thing is that if you may not be a smoker, but your partner may be a
passive,
smoker,
yeah.
or somebody you are staying with, or a co-worker may be a smoker, and your case is more serious than the person. So we, those who smoke, must stop smoking. Those who take in alcohol must also stop taking in the alcohol.
Okay.
And also we need to control our diet and our weight, not making sure we eat a lot of vegetables, a lot of fruits, and also taking in less carbohydrates and less sugar. We need to also try and breastfeed our babies for about 2 years, because that 2 years it protects us from getting breast cancer as well. We need to go for our regular clinical breast examination, and those who are above 40, get your mammograms done. If you have a family history, you will start your mammograms from age 35 and get your breast checked by experts. And also we need to, there are people who know that they have a family history, especially their mother died of breast cancer, their sister died of breast cancer, their auntie died of breast cancer. Some people will go and opt for surgery for both breasts to be taken off so that they will be free, like Angelina Jolie did. So these are some of the things that we
The
can
breast
do.
look like it's not even there.
Yeah,
For you to come and start.
yes. So that is what some people do, and also taking in a lot of water, doing some exercises just to boost your immune system. It will help in preventing breast
So
cancer.
the boosting of immune system too is very very critical
Important,
here,
because
very
at a
important
point
here.
in time, everybody, you may get a cancer cell surfacing in you because cells dies and cell come to replace. But then if the immune system is strong, it clears it off.
You see what I've been talking to you every day about double red rose. It boosts your immunity. It helps build those dead cells. It's an antioxidant powerhouse that clears the free radicals in your system. So you see that the expert is talking about boosting your immunity. So you have to come and get your double red rose and then get your immune system boosted. So Gifty, before we go, any other thing you would want to tell our listeners?
So what I want to tell our listeners is that let us not see cancer or breast cancer as spiritual or somebody bewitching you or as contagious. please see it as you getting malaria. And if you don't take treatment, you can die. Same way, if you don't start treatment on time, the breast cancer will advance. And so we are also saying that try and check your breast every month. We all have smartphones. Go to YouTube and type self breast examination. It will teach you how to examine your own breast 7 to 10 days after your menses.
Okay.
Then every year or twice in a year, you come to the hospital for the experts to check your breast.
To also do their own
For you. And also we should try our best, our religious leaders, to talk about the support for breast cancer and letting our people know that it's not contagious. And also, even though we are doing our prayers for our breast cancer patients, or also praying against we not getting cancer, but then if you get cancer, please come to the hospital whilst you do your prayers. Our doors are open. Come to the specialist OPD for free breast screening, and also at the oncology unit at the Tamale Teaching Hospital
within this month,
and also the polyclinic.
Okay.
Come and get free breast screening done. And even after Pink October or after October, you can still go to the specialist OPD from Monday to Friday and get your breast checked for free.
I'm busy there.
So now a room is dedicated for
that
screening.
Okay. For the free screening.
Any
day
from Monday to Friday.
It's not only on
Wednesday and not only in October.
Oh, okay.
So after October, still go to the specialist OPD room 3 and you'll get your breast checked.
So how often should the professional check it for you?
At least once or twice a year.
Once or twice a year.
Yes, but then if you notice anything, any lump or any change on your breast after you have visited the clinician in the hospital, still go back for them to check for you. Don't say that, oh, they said twice a year, so no.
I've done
Once
one,
you have any doubt about your breast, please just go for the experts to check for you.
Once you have any doubt, you don't wait, you quickly go for it to be checked. So at least once or twice a year, go for the checkup, not just the pink month, which is the month of October. So some of us think that you can only get the free screening from the professionals when it is the pink month, but she's made us aware that any other day apart from the pink month, you can walk in there. A room has been dedicated for that. So just walk in and say, I want to come and have my breast screened, and it will be done for you. So last year we had some organizations, some institutions reducing the is it the mammogram?
The mammogram,
yes. Do we still have some this year?
This year too, there are institutions that have reduced their mammogram. You can get it at Platinum, you can get it at Habana to be done for you.
Okay.
Yes.
About 50% slash?
Yes, 50% slash.
Okay. So yes, it's a good news. Yeah, announcement free and more, but it's for the love of you out there.
Yes.
Yes.
So if you're above 40 years.
Above 40 years. So 40, 50, 60, even 70, you can still go and do it.
Yes.
So any ceiling there, okay, so after this age there, you are free from it.
It's only cervical screening that I think after 4 or 5 screening, if you are negative then, but with the breast we don't have, because we had 82 years old with breast cancer that we were treating. So with the breast, it's only cervix that I know that after 4 times or 5 times screening, if you are negative, then there's the chance that you may not get cervical cancer.
So there's no ceiling that, after this age,
no,
you could be free from
no
breast cancer.
No.
They are not you. They are not you. Okay, so it's been a wonderful discussion here talking about the breast cancer journey, mapping a way to recovery and renewal as well. So trust me, they need our support. The family members, we need to support them, and if they can open up to you for that support, then stigmatization too must stop, because they are not able to open up because of stigma. You understand? So let's put an end to stigmatization. Of course, nobody goes out there to buy breast cancer for herself, and nobody goes out there to invite it for him or herself. You should thank your God that it wasn't you. But if it isn't you, whoever it is, you need to support them, okay, throughout their journey, so that they can recover faster. Especially the curative ones, they can recover faster, and even the palliative ones, they can die in peace and are feeling loved by you, the family members. They shouldn't die abandoned and in pain because family members have abandoned them. It's not an easy journey that they are going through, so we really need to support them. Thanks very, very much, Gifty. It's been very educative program tonight, talking about the breast cancer journey. So today we are not asking you to go anywhere, that you can walk in at any time and have it checked. So please let us do that. And when it comes to the mammogram too, you can go to those places she mentioned, and it's slashed for like 50% within this month. After this month, it will go back to the normal amount that you, or price that you have to pay. So if it is 400, you are paying 200. Don't pay opedieng. If you wait till October ends, then you pay the full amount. So take advantage of the pink month and then have your mammogram done to check if there are any lumps or not, and then you'll be free. Say, oh, my dream, for now, dear, I am free from this thing called cancer. Thanks so much. So tonight I have been talking to Mrs. Gifty Safo Anan, who is an oncology nurse specialist. She's also the CEO for Cancer Care for Humanity International. Many thanks to you out there for doing the listening. Those who watched us on Facebook, we really appreciate your time with us. Thanks especially also to Kawawa and Alaji Chamu Old Soldier, all the way from Yapi, for your contribution to our topic tonight. We appreciate you. Godfred, thank you very much for the Facebook Live. He's also our technician on duty. Nakwale, we greet you. Litris Nakwale, you were supposed to be with us here in the studio, but you are a little bit under the weather, so you couldn't join us. We pray for good health for you. We pray that the good Lord himself will touch you and then heal you very fast. So Awufo Jabakate Abdul Razak says, good evening, Madam Madam KKB's AKB, and good evening to your cherished listeners. I always enjoy Love 360 program. DJ Zakios Monser Razak. Yo, thank you very much for always enjoying Love 360. We appreciate you so much. So yes, as always, today is Saturday night, right? Tomorrow morning we'll go to church. That's the Christians. So I always advise you to make sure your things for church service is ready today, Saturday, so that tomorrow you can go to church early. Some people enter the church when preaching is halfway gone. Don't be one of them. If you are one of them, let it end today. Go for intercession, praise and worship. And I will say yes, work fully. And how can you do that? By preparing on a Saturday. Don't wait till Sunday morning. Na fe na uko be wardrobe. O time when you atu afa han why ube wie kura no kwa will take you like 1 hour. Make sure today Saturday your dress is ready, your shoe is ready, everything of yours is ready so that you can go to church very very early. Thanks so much. My name is Akusia Kwatma Boache. You can call me AKB. Have a good night, and I also salute our producer Sami Ej wherever he is. Have a good night, and you sleep tight as well. We are out like that. Bye bye.